And I'm so pleased to be here during Mental Health Month, talking about the urgent need to improve behavioral health care services in our communities. And I'm really pleased to be here as well with Ranking Member Daines. I'm so glad you're my partner on this subcommittee. And I think there's a lot of great things that we can do on this subject and others as well. Everyone affected by mental illness or substance abuse disorders should be able to get the help they need so they can live a healthy and fulfilling life, period. And the good news is we can make this a reality. Before the pandemic, nearly 1 in 5 Americans had some form of mental illness, yet fewer than half received treatment. This lack of support is even worse in the communities of color. The pandemic has made things worse and exposed the weaknesses in the way we pay for behavioral health care in this country. In January, 41% of American adults reported that they were struggling with anxiety or depression. That's up from 11% before the pandemic. And more than 1 in 4 young people have reported having suicidal thoughts. Meanwhile, overdose deaths have surged during the pandemic. The CDC reported that more than 87,000 Americans died of drug overdoses during the 12-month period that ended last September. That was the most deaths in any year since the opioid epidemic began in the 1990s. And long after the pandemic ebbs, these behavioral health needs are going to continue, and that's why we're here today, talking about these issues. We need to finally treat healthcare above the neck the same way we treat healthcare below the neck. And the good news is we're making progress. I've worked with my friend, Senator Roy Blunt, and so many people on the committee to create the Certified Community Behavioral Healthcare Clinics program, now fully operational in 10 states with over 300 startup grants bringing services to people in 41 states now. We have a structure that allows clinics to truly meet the needs of their communities. This has been a tremendous success in a short amount of time, and it's the model for the future, I believe. These clinics are required to provide comprehensive services, including 24/7, 365 mobile crisis team services, immediate screening and risk assessment, easy access to care. They see everyone who walks in the door. They have tailored care for active duty military and our veterans, care coordination with primary care providers, and coordination with law enforcement. The results are stunning. According to HHS numbers included in the budget request last year, people who receive services through what we call CCBHCs had 63% fewer emergency department visits for behavioral health. A lot of time folks are just sitting in the emergency room, maybe an officer with them, because there's no services available. They've seen 60% less time spent by people in jail who really needed help and services. And law enforcement now has other opportunities and in places where they can work with people to get people the care they need rather than sitting in jail. And they saw a 40.7% decrease in homelessness. So important. And today, the National Council for Mental Well-Being, which was previously the National Council for Behavioral Health, released a new CCBHC impact report with similarly stunning results. They found that more than half of these clinics offer same-day services, and nearly all of them offer treatment within a week. Compare that to the average wait time of 48 days nationally, and they're serving thousands of new people. 95% of CCBHCs have engaged in promising new practices in collaboration with law enforcement and our criminal justice agencies. This month, Senator Blunt and I, hopefully joined by all of you, will be introducing legislation giving every state in the country the option of participating in this full successful program. It will ensure that behavioral health care clinics are reimbursed for services in the same way we fund federally qualified health centers. We can get this done, and we can bring community care to millions of Americans who need it. So I'm going to thank our wonderful witnesses who are with us today virtually. We have colleagues who are here with us in the Finance Committee room and others that are with us virtually as well. And so many of my colleagues have focused on this issue and care so much about it. I'm so grateful, whether it's what I'm talking about with CCBHCs or the importance of telehealth, crisis supports, coordination with law enforcement and schools, and so many other ways to address mental health and substance abuse. It's all very important. And I really look forward to working with each of you. Now I'd like to turn it to Senator Daines.
Madam Chairwoman, thank you. I'm really glad to be here with you today, the first subcommittee hearing of the year. Mm-hmm. It's also great to have a fellow Montanan joining us today. We'll get into a more formal introduction in a bit, but a warm welcome to Lynette. I am glad you could be here with us today. May is Mental Health Awareness Month, an issue at the top of my mind and many others following a year of isolation for Montanans and Americans across the country. In fact, last year, due to COVID restrictions, Montanans and Americans were forced to stay home. We saw family-owned and small businesses shutter, workers struggling, family members isolated from loved ones, schools closed, directly impacting our nation's youngest and brightest. Through no fault of their own, hardworking Montanans and Americans across the country lost their jobs, leaving them wondering how they were going to keep a roof over their families' heads and food on the table. Instead of socializing and learning with their friends in classrooms, students were stuck behind computer screens, symptoms of anxiety and depression on the rise. In fact, one survey states that more than half of the adults reported that worry or stress related to the pandemic was having a negative effect on their mental health. And as we all know, mental health issues were a problem before the pandemic. In fact, it's estimated that nearly 1 in 5 American adults had some form of mental illness, but fewer than half of those adults received treatment in 2019. Since the pandemic, lockdowns, economic hardships, social isolation have only helped intensify what we already know, and that is we need mental health services in our communities, and we need to make this a priority. The pandemic has also helped expose and magnify the flaws in our mental health system. Sadly, in 2020, suicide was the 10th leading cause of death, and drug overdose deaths hit a record high. In Montana, we are unfortunately not immune to these devastating statistics. We're 4th in the nation for suicides. We're 1st in the nation per capita for children placed in foster care, most often due to a parent's drug or alcohol use. And we're witnessing a disturbing increase in meth-related violent crime. It's clear that more needs to be done to support individuals and families struggling with addiction or mental illness. We are fortunate in Montana to be home to treatment facilities like Rimrock, which I've had the opportunity and the privilege of visiting several times over the years. In fact, I even had the opportunity to bring Vice President Pence and his wife Karen to show them firsthand the great work the organization does for Montanans struggling with addiction and mental health issues. In fact, one visit I'll never forget, had the chance to meet with a few moms who were receiving substance use treatment. I'd just become a grandfather. I was overwhelmed with emotion to see these little ones there with these moms struggling with these addiction issues. But there I saw devotion, I saw struggle, I saw commitment, and so much love that the Montana moms had for their children. Because at Rimrock, thanks to a bill that I led in the Senate and was signed into law by President Trump, moms who are working to get back on their feet are able to stay with their children. Let me tell you, that means the world to these moms. It gives them a reason, a very important reason, to get better. Treatment centers like Rimrock make a world of difference in our communities, and they're more important now than ever before as we come out of this pandemic. And after years of lockdowns and closures, we're finally starting to see light at the end of the tunnel. And thanks to the leadership of our new governor, Greg Gianforte, life in Montana is on its way back to getting to normal. We vaccinated over 350,000 Montanans and have led the nation in vaccine administration. We are now open for business in Montana. We're open for school. We're incentivizing getting back to work versus staying home, something I believe is also important for mental health, because I believe there's dignity in work. But the reality is that there will be likely long-lasting impacts of the pandemic, particularly on mental health. We must aim to meet the challenges of today and prepare for the increased need that this pandemic has created. So I'm very committed to working with my colleague, Senator Stabenow, towards that goal. And again, I appreciate our witnesses being here today, offering their advice, their expertise on such a very important topic.